On the Scene video coverage of ESC 2012 is supported by Pradaxa.
Hi, I'm Deepak Bhatt here in Munich at the European Society of Cardiology annual meeting, reporting for On the Scene. We just heard the results of a randomized clinical trial, the Aldosterone and Diastolic heart failure trial. This interesting study took a little over 400 patients with diastolic heart failure, or presumed to have diastolic heart failure, and randomized them to either daily aldosterone or placebo and followed them for 12 months. The results of this study examined a number of different endpoints, such as exercise capacity and symptoms, and didn't find any difference in those parameters. However, very interestingly, there was an effect, a beneficial effect, on several parameters of diastolic dysfunction as assessed by echocardiography. And therefore, I think it is an important study that shows that there can be an effect of mineralocorticoid receptor blockade on endpoints like left ventricular hypertrophy. So even though there wasn't a difference in symptoms seen in this study, the beneficial effects on things like blood pressure and LVH should potentially translate into a reduction in clinical outcomes in a large enough study. So for the time being, I do think in a patient that has diastolic heart failure and whose blood pressure is high, as most of these patients have, might benefit from the addition of spironolactone. Stay tuned, there's more coming from the European Society of Cardiology with a bunch of interesting trials and registries to follow.